want to welcome you all here and say thank you for coming. Thank you for winding your way through whatever amazing maze you came through to get to Eccles Health Sciences Library. Now you know where we are, and now you can come anytime because this library is open to everyone, whether you're a healthcare professional, a student, or you are looking for your own personal healthcare information. This library is here for you. As part of this series, we have a whole bunch of presentations coming up, we need you to RSVP, and I'm sure that you all RSVP'd, and if you didn't, that's still okay, but I really appreciate your RSVPing.
I have a question on that. So I wasn't sure how many I'd be able to attend, and it said I could come back and do it later, but I clicked that RSVP thing today, and it says I've already done the survey.
Okay, all right, I will check. I don't know the answer to that, but it's better to RSVP and say you're coming than to not. So if you've done it and...
For today I did, but I'm
yeah.
not sure if I did for next week or any others.
Okay.
I was going to wait
all right.
and see.
I'll ask... we do this in collaboration with the Office of Health, Equity, and Inclusion, who graciously did the RSVP forms and also are providing the food. And so I don't have a final answer on that question, but I can get one. Along with these presentations, we are reading the Lancet Countdown Report. There's both a full and a brief version of the report. And we are also reading the U.S. Global Change Research Program's Climate and Health Report, and then other articles recommended by the presenters. Those articles are in the Live Guide. If you received an email about this program, then you received an email. In the email is this link to the Live Guide. And that will list a whole bunch of resources that you can take a look at about climate change's health and health equity. So now I'm very honored. I'm Joan Gregory, and I coordinated the whole series. I am very pleased to introduce to you Dr. Jeffrey Anderson. Jeff is a distinguished clinical and research physician at Intermountain Health Center Heart Institute and tenured professor of medicine and cardiology at the University of Utah School of Medicine. As an academic physician and medical scientist, he's pursued a broad interest in cardiovascular diseases and prevention. With his colleagues, he's published over 700 peer-reviewed and invited articles and book chapters and over 600 abstracts presented at national and international meetings. One expanding area of research and personal interest over the past 15 years is air pollution and the impact of climate change. In addition to supporting and participating in local research on air pollution, he volunteers as a member of the Citizens Climate Lobby, which is seeking federal and state regulatory solutions to our high local and national carbon footprint. Would you join me in welcoming Dr. Anderson?
Thanks so much, Joan. Delighted to be here with you. As you've heard, I'm a medical physician, an academic physician that also has interest in and concern for what global climate change is doing to our health. I have 1 foot here at the University of Utah, 1 foot Intermountain Healthcare, so wherever you go, I think it leads probably to one of those two systems, and I think both of these systems are really quite concerned about this. I don't have really any financial concerns. I just have general concerns, medical concerns, both for me and my family, as well as for you. And my interest, I guess, was really spurred now over 10 years ago when a friend of mine recommended that I read this book. Have any of you read this book? Yeah, we have several hands going up. It's now old, by James Hansen, and The Truth About Coming Climate Catastrophes and Our Last Chance to Save Humanity storms of my grandchildren. And as I read through this, I became more and more concerned and alarmed as I learned a little bit about the terms tipping point and existential risk. And so if you don't know what those mean, that could be a whole different lecture. But so in any event, my interest has continued on. So this is just a discussion, some points we're going to go through. Just a couple of points on trends that now have been firmly established in terms of warming. And then I'm going to focus primarily on the Lancet Countdown article because it's a little more recent. But the other article, the U.S. Global Change Summary, is a wonderful article. It's like 312 pages, so I'd suggest you read the executive summary, which is terrific, wonderful background to start with, and then you can dive into individual sections where you want more information. And then we're going to move on into, and there are 8 indicators that I'm going to focus on in part 1 of that Lancet article. It's a big article, and I think some of the other speakers might focus on some of the other parts. Then we're going to talk about air quality and its impact not only globally but locally here as well, because we've been involved in that, and then perhaps one approach to maybe solutions. So, you know, this is all overwhelming and not too positive information we're going to present. So what can we do about it? We'll just talk about at least one group that's working on that, the Citizen Climate Lobby. So here's some of the trends that we're seeing. First of all, just in terms of what is actually happening to land and ocean temperature, and you can see that sort of we're taking a inflection point here about 1930, and before that, if we use that as a basis, generally lower temperatures, and then, and especially the last, since about 1970 on, just this inexorable increase in temperature. And it doesn't sound like a lot, up to maybe 1.5% to 2% right now, but it's amazing what a small change in temperature how it can impact basically not only global events, but our health. So we talk about greenhouse gases that are now known to be responsible for this, of which carbon dioxide is the major one that we're producing through burning fossil fuels primarily. And this is where these emissions come from. Just from a year or two ago, transportation, 29%, electricity generation, 28%, industry, 22%, and then our homes, commercial and residential buildings, 12%, agriculture, 9%. But the key here is that 87% of the energy generation overall from these sectors comes from the burning of fossil fuels. So that's the one thing that virtually all of them, perhaps agriculture the least, have in common. So what about locally here? Well, this is just one graph, and these are sort of ones I just have picked up over the last couple of years. This is Tooele, high temperatures and the decades. These are days above 100 degrees. You know, almost nothing down here from 1900 to the 1980s, and then 94 days in the 2000s above 100 degrees. So let's say you want to instead move from Tooele to Salt Lake County or Salt Lake Valley. You're not going to escape it here either. And again, we can see record highs and record lows. And from 1877 to 2016, you can see there are a lot of grays in here until about here, 86. And sometimes even more than reds or balanced. But starting here in about 1987, you can see that the reds greatly outweigh or outnumber the grays, and the last 10 years really it's overwhelming the number of days above that are records versus the record highs versus record lows. And then a growing impact of climate change on wildfires, which you know is right here at home in the state of Utah. In yellow, over the years, we do expect some change just based on our demographics in wildfires, but you can see that with climate change, that has basically doubled. And here is in Utah. Locally, almost 500,000 acres burned. This was just an article from 2017. And so then let's move on with those sort of examples of things that are happening, both globally and locally, to get into some details. So this is the Lancet countdown article that we're going to focus on. I'm going to focus primarily on the Lancet countdown on health and climate change from 25 years of inaction to a global transformation for public health. And this was published just October 30th, 2017, so 2 years ago. But everything in here is still correct and just probably getting a little worse. But I like the way that they presented this as an opportunity for us. And this is what they concluded overall, that anthropogenic climate change, man-made climate change, threatens to undermine the past 50 years of gains in public health, of which, of course, I've been a part, trying to increase this. And conversely, a comprehensive response to climate change could be the greatest global health opportunity for the 21st century. So I like the emphasis on opportunity. We really need to take that opportunity and do something with it. So in this article, what they do is present indicators to track what's happening broadly in terms of this problem with climate change. And we're going to focus on Section 1 a little bit in Section 2 and 3, and then the other speakers will pick up from there. But Section 1 presents measures of exposure to climatic hazards and vulnerabilities of people exposed to them, and to quantify the health impacts over time. And then in Section 3, we're going to talk about specifically the problem of air pollution primarily. So there are 8 indicators in this Section 1 that this global climate change consortium is focusing on to measure what's happening. And to see if we can get control of these indicators. Indicator 1.1 is interesting, and it's that despite that average increase in temperature we just mentioned a few slides ago, that the people experience far more health effects of climate change than the global mean temperature rise. Not everybody knows that. I think I didn't realize that until recently. So what they look at is something called people-weighted exposure, and compare it to area-weighted exposure just based on random piece of land, and it turns out it far exceeds that. So here in red, the bottom line, we see the trend in average area-weighted exposure, the average increase in temperature in any square mile, let's say, around the world. And you can see since 2000, and this just goes back 16 years, it's gone from about 0.1% to about 2%. But for the average person, because of where we're located, and often located together in groups and cities that experience greater change, it's gone from a little less than 0.2, you can see, to over 0.6. So, and even though, you can see there's year-to-year variability, there's random change over years and variation. Clearly, statistically, that trend is upgoing and is highly significant. So we experience double the average temperature change that otherwise is measured just based on area. Let's see, what do I need to do here? Next. There we go. Okay, so that's indicator 1 of 8. Indicator 2 is that the evidence is clear that exposure to more frequent intense heat waves is increasing, with an estimated 125 million additional vulnerable adults exposed to heat waves between 2000 and 2016. And there was a record of 175 million more people exposed to heat waves in 2015. So let's go and show you that. And again, there's year-to-year variability. We know that one year gets more and another year less rain and temperatures, but overall we can see that beginning in 2008, there's a consistent rise. In 2015. You can see it was 175 million people that were exposed to extreme heat waves throughout the world. So clearly going up. And we're going to talk about consequences of that, and especially in older adults, and I get to count myself as over 65 for one, or in children. So that's number 2. Indicator number 3 is just from the turn of the century until now, increasing ambient temperatures have resulted in a reduction of estimated 5.3% of the manual labor productivity worldwide, primarily outdoor and more rural labor of people working outdoors. They just can't work when there's excess heat. And so you can see this trend is very, very clear again with the variability, the ups and downs, but overall that's a clear trend, downward trend with, in 2016, a big dip especially. And so, of course, at the very time when we have populations increasing and needs for labor increasing, we have labor continuing to fall. They just can't work in those temperatures. So that's number 3. So number 4 is the frequency of weather-related disasters has increased by almost 50% over just the last 10 years compared to the 1990s. And there's no clear trend in this getting any better in terms of we as physicians or others, public health people, taking better care to reduce the lethality of these events. That stayed about the same. So let's look at these data. And again, this is a busy slide, but this is from the article, so if you get some idea of what it's looking at, then you go read it. It'll be easier. So let's just focus here on this red line here, which is occurrences. And so it starts here, goes around here, goes up here, down, and down a little bit. But overall, this blue dashed line is a trend, and that's highly significant for an increase. And in contrast to that, these other things are looked at: deaths and affected lives, and trends of occurrences go up and down. A couple of big spikes here where there might have been a major tsunami, but overall there's not a huge difference in that. So there are more events, the chance of dying or being severely affected is about the same, but because there are more events, there are more of these that are occurring. And, out here in the West, of course, as we mentioned before, we have these devastating fires. This is in California. We know here in Utah that that's a major problem as well. And then in the East, especially Southeast, devastating hurricanes. This was just one of the more recent ones, Hurricane Dorian, just leveled the Bahamas, especially some of the islands of the Bahamas. So one question is, so depending on where you live, these events differ. As we mentioned in the West, we have droughts, we have heat waves, we have wildfires, and then in the East we have hurricanes down here in the Southeast. We have extreme precipitation in the Northeast and floods. And so it varies, but none of these are good things to experience, and they're increasing. So one question I had is, what's the impact of each of these? Which one is the worst in terms of its impact on health as well as cost? And it turns out that heat waves are the big ones here on the left, with 10-year total fatalities over 1,200, and then tornadoes and hurricanes right behind with 1,100 lives lost, and then floods here in the middle, and then windstorms, lightning, cold waves, winter storms. And then here on the right, we see the billion-dollar losses. And here, hurricanes take top place with about $400 billion loss. As you see the devastation be created by these major hurricanes, it's not hard to imagine how that can add up. Almost $80 billion from heat waves and droughts. almost 50 billion from tornadoes and severe storms, and then 30 billion from flooding and severe storms. So just a huge economic. And think what we could do if we took that money and put it into actually trying to solve some of these climate-related changes, instead of having to pay it out for these things that are just going to continue to get worse. So number 5 of 8 of the indicators that are being tracked now by this initiative is that global health initiatives have improved the health profile of populations around the world. Of course, that's what those of us in physicians or health-related professions have been working on. But this trend, that this unmitigated climate change is going to undermine. If we can't get a handle of this, we're going to lose. So it's interesting if we look at these statistics. This is a figure from the table, and I'll try to take you through. If we look at all-cause mortality, and this is broken up by region, but let's look at the black here versus Africa, where, of course, these are very vulnerable people. In the top, all causes of deaths, you can see it started out, and this is from 1990 to 2015. That has come way down from about 1,300 to 800. So that's wonderful progress. And a lot of that is diarrheal diseases. So for Africa on the top and other areas, the vulnerable areas, that's come way down as well. That's one of the major causes. Not so much forces of nature, we talked about that there. Heat and cold exposure, however, is going up. Malaria, we've gotten a better handle on that. That's come way down. And then post-energy malnutrition. We've been working on better nutrition for third world countries. On the other hand, you can see malignant melanoma, more sunlight, and Utah's right at the top, isn't it? It's number 1 in the country in terms of malignant melanoma. More sun exposure is going up, as is heat and cold exposure. And then, so we made great progress on most of these areas, but there's some that we're really concerned about. One is dengue fever, and we'll talk about that in a minute. Okay, so this is indicator 6 of 8. Climate trends have led to a global increase in the vectorial capacity for the transmission of dengue from Aedes aegypti and albopictus of 3 and 5.9% in the 1990s to 9.4 and 11.1% compared with 1950 levels. And I didn't turn this on from mute, so I just remember that, so I apologize for that. So let's see what that means. So vectorial may be a foreign term to some of you, but it just means the transmitters of these diseases, like mosquitoes, like ticks, etc., that do that. So let's see what's happening here. So these are 2 bad mosquitoes. They carry lots of bad things. And again, compared to, let's say if we take about 1990 as a baseline, before that you can see very low, and now since then we're in the red. They're coming up for positive cultures from these mosquitoes. What about Utah? Well, we have just joined this Aedes aegypti club, where most of us think, oh, that's something in Africa. And so this was just from the newspaper just this past month, September 13th. Yellow fever mosquito invades southeast Utah. This is Moab. We were just down there a while ago. It's a beautiful place. An aggressive mosquito that hides out in children's toy trucks and wheelbarrows has invaded southeast Utah, and it loves to bite people. What's worse is that it's an efficient carrier of viruses that include yellow fever, dengue fever, which we just mentioned is on the rise, and Zika fever, which we've heard has devastated populations in Brazil because of its effects in pregnant women on unborn, and the rare chikungunya virus. And so the detection of this in the Moab provoked a rapid, aggressive attack Wednesday and Thursday. So it's right here in Utah. And then maybe you've heard about this just in the last couple of days, this last week. Triple E virus, Eastern equine encephalitis, growing, and a third of the cases are lethal, and many of the others that are infected have permanent neurologic damage. This is in Massachusetts and Michigan, so primarily in the northeast, but could be. There's another disease called Lyme disease. This is a tick-borne disease. And it actually, we're seeing this in the West as well, but primarily it's known to be on the East Coast, New England area. And you can see that these are changes in case report distribution from 2001 to 2014. And this is the tick that carries this bacteria that causes chronic arthritis and heart problems, and dramatic increase here because, again, more warm days, and more opportunities for these ticks to stick around before they get killed by frost. Fewer birds around and other natural enemies of these ticks. So those are just examples of we're going to see more insect-borne diseases in the future. Okay, this is indicator 7 of 8, is that climate change increases vulnerability to undernutrition. The number of undernourished people, if we look at the 30 most vulnerable countries, has increased from about 300 million in 1990 to 422 million in 2016. That's the last time where we have good data, at least when this was published. Further, fish consumption is decreasing, which is another indication of food insecurity. So, and then we'll talk about how this is affecting immigration, which should be close to home here. So I just had to put this more in words, but these regions with the highest vulnerability to undernutrition, which are Africa and Southeastern Asia, are also where the yield losses due to climate warming will be the greatest, increasing their vulnerability to health consequences, and especially those that have a high dependence on one crop increases vulnerability further. For example, in Kenya, and if you haven't been there, there's some wonderful game preserves. It's a wonderful, beautiful country, but they have a domestic production dependency for cereal grains of almost 80%. They don't import much. 80% they raise themselves, and 69% dependence on maize or corn. So that one crop is tremendous dependence on that, and when that's affected, that has tremendous impact on undernutrition, which is already a major problem in Kenya, and so drought, reduced production because of excess weathers. And then if we look at populations near the coast, decreasing food consumption is an indication of food insecurity, and these communities are especially vulnerable to the decreases that we're seeing in fish stocks. And it's concerning for the 1 billion people who rely on fish as their principal source of protein and placing them at increased risk. Well, one of the problems with warm temperature poses would be increased bacteria and toxic algal blooms. So we're thinking, okay, that's off somewhere else. But if you just recall that we have those toxic algal blooms here right in Utah, don't we? And here's just an article from a couple of years ago, and wow, that doesn't look like water, does it? There's just that green. These bacteria spread to cover almost all of the Utah lake, turning the water bright green with a pea soup texture and leaving scummy foam along the shores. It's closed one of the largest freshwater lakes west of the Mississippi, sickening more than 100 people, leaving farmers scrambling for clean water during some of the hottest days of the year. So right here in River City, we're seeing this problem in our waters as an example. So this is the last indicator in this section of this article, number 8. And this is something that maybe we didn't think about, but is a very important one. Climate change is a major increasing factor in migration and population displacement. The total number of people vulnerable to migration might increase to 1 billion by the end of the century without further action on climate change. And those who have been sort of thoughtful about some of the factors that are causing this mass migration from Central and South America up here to our southern border, is that the lands that they used to used to farm down there have become non-arable, and that's one reason they're seeking other pasture, more productive pastures, so to speak. So just a couple of comments then on this last indicator. Climate change-induced migration can occur through a variety of social and political pathways, ranging from sea level rise, coastal erosion, to changes in precipitation temperature that reduce the arability of land and exacerbate food and supplies. And as I mentioned, that I think the migration problem we're seeing at our southern border has this as one of its major causes. And estimate future climate change vary widely. We don't really have a handle on this, but could be from 25 million to 1 billion people by 2015. And in the long term, melting of the ice sheets, which is occurring much more rapidly than at first we had predicted, is going to impact people living close to the shore and at elevations close to sea level. And if we use 2000 as a baseline, population living below 10 meters, so just 30 feet above sea level, will increase from 630 million to over 1,000 million by 2015. And so that's increasing, and much of that land will be covered with water as our ice sheet collapses and melts. Okay, with all that good news as backgrounds, but I mean urgent news, because on the other hand, it's an opportunity. Once we see what's happening and recognize that, that's the first step to figure out what are we going to do about it. What's our political will to start addressing some of these issues. So one of these that's also very close to home, if you've lived in the Salt Lake Valley for a while, as our family has, is that air pollutants are a big issue. They're directly harmful to health, and they are emitted by combustion process that also contribute to emissions of greenhouse gas. So even though the greenhouse gas carbon dioxide is not an air pollutant, the same processes that cause that also increase carbon dioxide. So addressing one can also address the other, and that's a great opportunity. And so the indicator reports that 71% of almost 3,000 cities in the WHO database. It's interesting that worldwide there are 3,000 major cities, and they've tracked, or at least that are tracked here in the database, do not satisfy WHO fine particulate matter exposure recommendations. So let's look and see where those are. So here we have GPD, domestic product, poor countries, rich countries, and then here we have the annual mean PM25, 2.5 concentration. And this dashed line way at the bottom is WHO recommended guidance levels for 10 micrograms per meter squared. And you can see there are not many that are below this. And most of them are up here. The poor cities where there are lots of population. There's Delhi, India. Have any of you been there and saw the Taj Mahal? When I went there, I could hardly see. It looked like a foggy day. There was so much smoke looking at the Taj Mahal. So Delhi's right up there. Baghdad here, Kabul, Beijing, Nanjing, a lot of Chinese and cities in India and so forth. Istanbul, Bucharest, Moscow, Hong Kong. Here's Chicago and London. They're not doing too badly. I don't think we have Salt Lake City on there, but you get the idea that most of those are above that line. Okay, so here are some of the selected air pollutants and where it's coming from. We need to know that before we can go after them. So on the top, and it doesn't include carbon dioxide, that's manufactured along with these, but that's not a pollutant, that's a greenhouse gas. Sulfur dioxide, nitrogen oxide, particulate matter, PM2.5, carbon monoxide, volatile organic compounds, the pneumonia. And then here we have the sources, power generation, combustion of coal, oil, gas, and so forth, industry, fuel combustion process, power, exhaust brake, and so on and so forth from transportation, buildings, cooking, heating, lighting, fuel supply, extraction, storage, transport, and then non-energy, agriculture, and so forth. And really only agriculture does not have contributions, or ammonia, I should say, does not have contributions much from all these other sources except agriculture. I guess cows are a problem up in Logan, aren't they, Cache Valley? We'll deal with that separately. But if you look at most of these others, they're really a combination. For example, carbon monoxide from buildings, from transportation, and from industry, and then sulfur dioxide from power generation and so forth. But most of them, have contributions from all of those different sectors of energy production, primarily from burning fossil fuels. But it does vary across the world. These are emissions of fine particulate matter in 2015 in the U.S. There's 31% from buildings. Transport is about a third, and then industry, and then others. So, from all sectors. In some other places, like Africa, don't have a lot of cars there. Most of it's just from buildings, and then some from industry and so forth. And in China, it's about 50% from buildings, from, there are a couple billion people there, and then others from an industry, for example. So it varies, but overall, more and more contribution in all of those countries. So what is the impact on health and, in fact, on mortality? And this review indicates that the data suggests that long-term exposure to ambient small particulates, PM2.5, is associated with increased mortality and morbidity from cardiovascular, close to my heart, and pulmonary diseases. And WHO estimates that this ambient air pollution causes about 3 million premature deaths worldwide every year. And as we mentioned earlier, the sources of air pollution, greenhouse gases, are overlapping, so greenhouse gas mitigation measures can have large co-benefits for human health in terms of air pollution. Here's a picture of the Salt Lake Valley over Salt Lake City during the winter. I hate to, we're all hoping it won't be like this winter, but it probably will. The interesting thing is that we have tremendous variability, and some days today is a green day. And so we have a tremendous variability from very good air quality to really bad, the worst in the country. And I'll tell you how that actually has helped our research in a minute. And so I got involved in research with our group, including my colleague Ben Horn and Arden Pope, who is well known nationally and internationally for his interests in this area, because we have monitoring stations all along the Wasatch Front that can tell us on any one day what the level of fine particulate matter is. And then what we can do is we can look in our hospital records to see how many admissions we had that day for heart attacks, for example, or for asthma or pulmonary disease. And the interesting thing is, as I mentioned, because our level of pollutants varies so much from day to day, we can actually use each patient that comes in with a heart attack as his own control. So what we do is we look at the day he came in with a heart attack, and then we compare it to a day in the same general time frame, the same time of the year, when he didn't have a heart attack. And then the question is, was the air pollution higher or lower or the same on some random day where he didn't have a heart attack in close vicinity to the day when he did? And what we found here, right along the Wasatch Front, and this is sort of a unique opportunity worldwide, is that for every 10 microgram per meter squared increase in fine particulate matter, there was a 15% increase in the risk of a major heart attack that day. And so the first paper that was published in Circulation, which is the major cardiovascular journal, looked at all heart attacks, and then the second one in the Journal of the American Heart Association looked at the most severe kinds of heart attacks, ST elevation, MI, the Hollywood heart attack, and that was particularly affected, especially if you had a tendency to heart disease to begin with. So a major impact for heart disease. And then more recently, my colleague Benjamin Horn got together with our pulmonary specialists, both at Intermountain and here at University and Primary Children's, to look at the impact on respiratory disease. This is in the American Journal of Respiratory Critical Care Medicine, just from September of last year. And they concluded that in this large sample of urban and suburban patients, again, the same methodology, short-term exposure to elevated PM2.5 pollution was associated with a greater healthcare use of ALRI, which is acute lower respiratory infection, in young children, older children, and adults. So certainly heart and lungs are major targets. Well, to bring things up to date, we've been talking about a 2017 paper. This is just last month in the New England Journal of Medicine, which is the major journal of medicine, the foremost journal in the world. And this was looking at air pollution and mortality in 652 cities worldwide. So, wow, this is a big one. And the conclusion, our data show independent association between short-term exposure to PM10 and PM2.5 and daily all-cause cardiovascular and respiratory mortality, not just illness, not just hospitalization, but mortality in more than 600 of these cities across the globe. This data reinforces the evidence of a link between mortality and exposure established in regional and local studies. So it really puts it all together. And here are the curves, starting out with low pollution PM10, low pollution 2.5, and just keep going up. Especially even if you get from very low to intermediate levels, there's a big jump there. So the data are very clear. And then finally, 3.6, trends in clean fuel for transport. Transport fuel use on a per capita basis increased worldwide by almost a quarter since 1990. Petrol and diesel continue to dominate, but the use of non-conventional fuels has been rapidly expanding, with more than 2 million electric vehicles sold in the last 7 years. So at least that's some good news. So then let's look at this. So here's the good news over here. Here's the number of electric vehicles worldwide going way up, and different countries contributing. There's Japan, there's China, there's Norway, and even the U.S. But here's the bad news over here. The percentage, you see that small little sector at the top, that's electric car use, and this is gasoline, basically, motor gasoline, and then this is other fuel oil in green. So we've got a long ways to go. We've made hardly a dent in that. And by the opportunity here, though, in red is a car. From Melbourne, 75%, to Tokyo is about 10%. And then here in tan, I guess that is, public transport, so quite variable, but a big opportunity public transport worldwide, and then there's walking and biking, which is great. So we have an opportunity for public transport or for government and big industry. And I like this advertisement, or I should say this news report just this past week, September 23rd, yesterday. Amazon is going to buy 100,000 electric delivery vans. So that's a good start in terms of showing a good example. So progress is being made on 7 of the 10 Lancet 2015, that was the prior report, countdown recommendations in terms of investing in climate change and public health research, in terms of scaling up financing for climate resilient health systems, in phasing out coal-fired power, except maybe in the United States recently, encouraging a city-level low-carbon transition to reduce urban pollution. Boy, we need that. Rapidly expanding access to renewable energy, unlocking the economic gains that are available for this transition. This could be good news if we just latch onto it. Agreeing and implementing an international treaty that facilitates the transition to a low-carbon economy. We need to get part of that in the U.S. Develop a new and independent collaboration to provide expertise in implementing these policies over the next 15 years. So we're making some progress. We just need to accelerate that. And then I just want to end with a little advertisement, I guess it would be, in terms of how can we personally get involved. And there are many options. One that's I happen to be familiar with from a friend who actually gave me that book 10 years ago, who's been involved with this, is the Citizens Climate Lobby that is working on one solution. And so this lobby is a nonprofit, nonpartisan grassroots organization focused on national policies. There's also a local Utah chapter on climate change. And its core values are focus, optimism, relationships, and integrity, personal power, and being nonpartisan. So their philosophy is that science is not political, and the same laws apply to Republicans and Democrats or any other party alike. So it affects every one of us, regardless of how we vote. And so their particular proposal is a carbon fee and dividend tax. So place a fee on fossil fuels at the source, at the mine, at the well, or the port, and return all of the revenue from that tax to households equally based on their carbon footprint. And then they adjust at the border as well from countries without an equivalent price on tax that they would put it on at borders so that we don't get undercut. So that's what they're working on, and they have an annual lobby day in Washington, D.C. This is in June, that is growing. And one of their initiatives is what they call the Congressional Climate Solutions Caucus, and it's growing. It's in the House right now. The one in the Senate is just starting. But the rules are that you can only go in if you have a partner for the other party. So if you're a Democrat, you got to get a Republican to join with you, and vice versa. And I think they're nearing about 100 now of members of this lobby, so that they can start having some substantial impact. And then locally, there's a Climate Utah, and here's the governor signing a bill, and we've gotten young people involved. It's their generation that really should be the most interested, and they certainly are. And here he's signing a bill. Let's see, here we go. Let's see. Last year, HCR 007 resolved that we should prioritize our understanding and use of sound science to address causes of a changing climate. Resolved that the legislature and the governor encourage individuals, corporations, and state agencies to reduce emissions through incentives in support of the growth in technology and services that will enlarge our economy in a way that is both energy efficient and cost effective. So that all sounds like good stuff. We just need to see some action on it, which we hope will come. So that's all I have to say, but thank you very much for your attention. I hope that that's sort of interesting for you. And
okay, so we have about 10 minutes or so left for our session, but I also know that you all haven't had a chance, or not everybody has had a chance to get seats. So, but I don't want to encourage you to leave. I want to encourage you to stay, because what I'd like to do is to do a Q&A with Dr. Anderson. But I want to give you just a few minutes to get you started. Go over and sit. So, everyone, feel free. Questions and answers and discussion. You ready? Yeah. Okay. All right. All right. So you're on. You're plugged. You're still on.
she just took it away.
Oh, okay. Oh, all right.
But hopefully people can.
All right. So we're going to be moving. Is this working?
Sky, is this working now? Okay. So we're going to be moving back and forth because we have one microphone that's working for this, and we'll question, and then so Dr. Anderson can answer, or if the answer is in the audience, that's okay too.
A lot of you have expertise in this, so I appreciate your comments, not just questions.
And comments as well.
I had a question. Have you or has anybody kind of looked at the synergistic effects of these different threats from climate change? Like the data you showed was very interesting in terms of like the number of people expected to be affected by drought or heat waves or anything like that. But I imagine for a lot of communities, they're going to be under multiple threats. They're going to be facing sea level rise, algal blooms, increased drought. And do those factors are they sort of additive, or do you see these sort of exponential increases in the number of people affected?
So the question is, what about areas where we have multiple things happening? Absolutely, no question about it, and that's what makes it so challenging. I mean, just take right here. We've talked about air pollution. We've talked about fires, and actually the next research project that we're going to be doing is comparing air pollutants caused by fires in the summer with air pollution in the winter, and what are their contributions? Algal blooms we talked about. We've seen that we have mosquito-borne disease that's coming in. I know the ski industry might not be health related, but is interested in the snowpack and the mountains. So absolutely no question about it. It's going to take a coordinated effort. And we in the healthcare industry are particularly concerned about the consequences as well to our children, not only with lung disease, but as we get older, also heart disease over the long term. So we need to learn more about it, but we also need to start. We know enough to know that the one thing that's common to all of them is increasing temperatures. So if we can deal with that as a higher priority, then that'll really help us deal with these other things.
So you may have noticed that this doesn't necessarily amplify my voice in the room. It's going to the recording of the session. So that's why we're using the microphone. Someone had their hand up, and now I lost track of where they were. If there's a sign-in sheet, and if you have that sign-in sheet, if you would continue to pass it around. Thank you.
Can you explain, maybe in a layman's easily understood way, why pollution increases the chance of heart attacks?
Yeah, sure. So why does pollution increase the chance of a heart attack? Do you want me to wait for a second for that? You talk very loud. Does this help you or not? Okay. Great question, because, it gets to your lungs. Why does it affect your heart? The reason is when it gets to your lungs, it causes inflammation. Your lungs don't like this, and so it increases inflammatory reaction. The number of inflammatory white blood cells goes up. There are certain chemicals, if you will, we call them cytokines, that are increased by this inflammation that circulate then, and that causes a tendency for blood to clot. So especially if you happen to have plaques in your arteries and you have a little roughening in that artery, that now instead of just flowing beyond it, it starts to form a clot there, and that's the reason why. So it increases inflammation in your system. Same thing in the lungs. Asthma, that irritation causes asthmatic attacks and respiratory insufficiency. So that's a simple way. Hopefully that makes sense. Yeah.
I'm curious to know about, do you feel like the medical community locally is getting more on board about climate science, and are you getting less resistance? I wish we could get the political leadership to recognize, if nothing else, the dollars that are being lost. It seems all they care about. But how do you get received in the medical community when you bring this message?
Well, I hope it's being well received. Actually, you have a couple of visitors right here today next to you who are involved with the Citizens Climate Lobby. And maybe I can ask, Dave, do you want to speak to that?
Wow, thanks so much. Well, and we're going to hear from Leroy next week. Yes.
We certainly hope that's the case.
Let me finish my mouthful here. The issue is how the medical community is addressing this, and I don't know that I'm very qualified to address that other than as a member of Citizens Climate Lobby, I found it very effective to address both the grassroots level and the grass tops level. And the grass tops level where we're working is with our congressional delegations. And there we've engaged all 6 congressional delegations within the state. We've met with them multiple times. A couple of times a year we have liaisons that meet with them, and we meet with them as groups. And we've found they listen to us, some of them much more than others. And I think we're very pleased that this year we can say that probably half the delegation is speaking very positively in terms of belief and concern about climate change, and hopefully taking some action, the action being a little lagging a bit from the talk. But we're hopeful.
Thanks very much.
Well, I think you can guess who's positive. We have a Democrat and we have a senator who's on board, and we have my own Congressman Curtis, just in the last month, has made very public statement about climate change is real and it's man-made. I think that's big. We hope to see more.
I think people in the medical community do have an opportunity to just demonstrate some leadership, and I just want to thank Dr. Anderson here for doing that. What he's doing today is exactly what we need to do. The medical community is also part of the scientific community, and the scientific community is on board with this issue. And being part of a larger community and also having a link to regular people, I think the medical community does stand in a special spot to convey the information that needs to be conveyed. And everyone's interested in their health. And so it may be a bridge issue for us to start some movement here.
Okay. So are we? Yes, we are right at time. And I, hate to cut off conversation, but people need to get back to work, or back to other activities. And so, but Dr. Anderson, are you able to stay a little longer if people want to come up and ask you questions? So I just want to thank Dr. Anderson again for his presentation and for being willing to come here and talk with us today about climate change and air quality. Thank you. I also want to let you know that next week, same location that you got to this week, so you can get here next time, is a focus on mental health and well-being, including eco-anxiety. And so we're going to look at the impacts on our mental health of all that is happening with climate change. So I hope you will join us. Take a look at those documents. It is hard reading to go through the Lancet Climate Countdown report and the other report. There are also some additional readings associated with each of the sessions that are usually a little easier to read. So please take a look at some of those and come back ready to look at mental health next week and spread the word. And I'm going to tell them 11:30 is the time to deliver the pizza the next week, right? All right. Have a piece of pizza if you didn't get one, and ask Dr. Anderson any questions you might have. Thank you.